With regard to patients who wish to retain their fertility who have fibroids, we have had 69 successful completed pregnancies in patients like that. And we've published, which is accessible on our website, to our knowledge, the largest pregnancy series following fibroid embolisation. We know that fibroid embolisation can render some people who were previously infertile fertile. Some patients who've had previously failed myomectomies can have successful pregnancies following fibroid embolisation. But the situation is complicated, and the patient has to be assessed by a gynecologist and radiologist, and an individual decision made with regard to the particular circumstances of that particular patient.
It was really a case of embolisation or hysterectomy. There was literally no other solution, because my cycles were so debilitating and so bad, and I couldn't get my levels up, my ferritin levels up. It was a case of, well, ideally, yes, I would like another child. I would like to have the option of having another child. And it was a case of, well, embolisation would give me that option. I understood the risks. My gynaecologist had taken me through the risks in great detail. I understood that following the operation, there was a chance that I may not be able to conceive or have more children. I understood that, but then if you look at hysterectomy, well, there is no other alternative. You know, there's absolutely no chance of having children. So we went down the embolisation route, and to my surprise, it was a very, very simple procedure. So the operation itself was really very simple, very little intervention. I had a very tiny scar, which has since faded. I couldn't tell you where it is even. It was about 2 millimetres in length. You weren't completely under general anaesthetic for the operation. It was just under quite heavy sedation. I saw Dr. Walker for my 6-month checkup, and everything had gone really well. The fibroid had shrunk by 50%. And again, I confirmed with him I could notice a difference physically and also in my monthly cycle. I asked Dr. Walker about about trying for another baby. I understood the risks about trying for another baby, and he gave me the green light to go ahead and try. So we did, and very, very quickly afterwards, I was delighted to find I was pregnant again, which was just superb and something we really weren't sure would happen or not, given the size of the fibroid before I had it embolised. So conceived again, and everything went very, very well. Fantastic pregnancy, no complications at all. The fibroid didn't grow in pregnancy. In fact, it shrunk another centimetre. And the scans during my pregnancy showed that the fibroid had indeed calcified, and it moved completely out of the way into my high right-hand side of my uterus. And I actually had to be induced. I went 6 days over my due date. And I had regular checkups from my obstetrician during that time, I must say, but there was no complications at all. Very healthy baby. So I was induced 6 days after my due date, and had a very happy, healthy, normal vaginal delivery. So no need for any caesarean section, nothing. Very healthy, very safe labour. And my son was born at a whopping 8 pounds. So absolutely no complications postnatally either, given in mind the complications I'd had postnatally with my first son. No complications whatsoever, no menorrhagia, no pain, no infection, nothing. Absolutely brilliant. So it's been a completely different experience this time round, given the embolisation operation that I've had.